Kidney disease does not discriminate, whether it be age, race, or gender. 3 young adults in the prime of their lives suddenly found themselves with their worlds turned upside down when faced with a diagnosis of kidney disease. For each of them, their lives have been significantly and positively impacted by improved treatment options, groundbreaking medical research, and the miracles of modern medicine. Here are their stories.
Primarily what I was noticing was a lot of fluid retention in my legs, my ankles, and it was to the point where, it was so bad that I was having trouble standing for long periods of time and just felt very, very tired, very sluggish.
Katharina pursued a graduate degree in the United States and was just starting her counseling career when she started feeling unwell. Concerned for her health, she decided to return home to Canada. When her flight landed, her parents were waiting to take her directly to the hospital.
They let me know that my kidneys were very damaged. They did a biopsy and they were both scarred quite extensively. And so they did tell me that dialysis was inevitable. There were no treatments that they felt they could try. It was very shocking. I think initially I was sort of in denial. I think there was so much to process. I almost couldn't take it all in at that time. And I think initially what I tried to do was come up with solutions. Okay, well, maybe I have a kidney issue, but I'll just wait and have a transplant right away. In my mind I thought, oh, I can live here in London until I get a kidney. It was a lot of sort of unrealistic thinking. And I remember when they started to explain to me about diet and what I would have to change in my diet, things like that, sort of not wanting to accept that at all, like, well, maybe other patients have to do that, but not me.
After spending a year on hemodialysis, a conversation with a nurse in the dialysis unit would change her life.
She came to me one day with information from the internet and said, have you ever considered nocturnal home dialysis? Just the independence of it and all the different things. So I really had never heard of it, and interestingly, none of the doctors had mentioned it, but this nurse had taken the initiative and brought it to me. And so I looked into it right away. I called the program at Humber, got more information, and it sounded amazing. Just because for me, I think the hard part was being at the hospital. I felt like I had no control over my own health. Even the treatment, you sit in the waiting room until they're ready for you, and then you wait for them to connect you, and then you wait for them to disconnect you so you can go home, and I'm always looking at the clock, when can I go, when can I get to bed, that sort of thing. And so the idea that I could do that myself and have my own schedule was really exciting for me.
Katharina met Paul, who would soon become her husband. It wasn't long before the couple started to think about children. With Katharina's complex medical history, they didn't know if it would ever be possible. And their initial trips to see medical professionals really discouraged them.
When I got pregnant with her, I was on dialysis, so we knew from the beginning it might be a bit of a different process, but it was actually a very, very healthy pregnancy, and I felt well, and uncomplicated delivery and birth. So so all of that went well, and it was a wonderful experience for us.
Katharina's home treatments are just part of daily life for them. Her daughter, Lena, likes to be in the room while Katharina sets up her equipment for her nighttime dialysis treatments.
Beep. It's the beep beep, isn't it? Beep. Did you hear Mommy's beep beep? Beep. Yeah, you hear the beep beep.
It was not until 2004 wherein another amazing benefit of nocturnal dialysis was realized, and that was the restoration of fertility. Dr. Chris Chan, the head of the UHN Nocturnal Dialysis Program, reported a successful pregnancy in a 31-year-old woman who delivered a healthy 6-pound, 11-ounce baby at term. In Toronto, we have now repeated this original success story many times with young women like Katharina, even moving on to their second pregnancy.
I think too, one of the things that stood out to me the most about Katharina was just the way that she was able to handle everything that she's been through. And she's been through some pretty big things with her health, and dialysis is no small task to have to deal with on a daily basis or every other day. That she was doing it when we met, and I've just always been impressed with her attitude and with the way that she's tried to live a normal life. The way that she does live a normal life, in spite of the fact that she does have dialysis to deal with. So.
From my perspective, I don't think transplant would be a good option. I think I've had so many medical interventions. I've already had 2 liver transplants. I've already had cancer. So going through another transplant would mean suppressing my immune system significantly, which puts you at risk, for things like cancer. And because my body has so many antibodies already, I think it would be difficult to find the right degree, the right balance of immune suppression for me to even accept a kidney. And from my understanding, kidney transplant is different from liver in certain ways, in that there's a limited lifespan for a transplanted kidney. So in my mind, 1 transplant would mean at least 1 more in my lifetime. So I'd be looking at 4 or 5 transplants, and I'm not sure that that would be realistic with the immune suppressant component of it. I mean, for me, I couldn't imagine what my life would be like if I didn't have nocturnal dialysis. So I think the research piece, particularly with kidney disease, is so huge. And I'm personally hoping for even more advances in my lifetime. I fully believe that in a number of years I'll probably be off dialysis. I think that there will be newer options and better options to replace my kidney function. So for me, research is invaluable. I'm sort of placing my hopes for the future and for an even better, fuller life on the impact that research will have on finding better ways.
In high school, Jane was diagnosed with lupus. She was put on a regimen of drugs, but 5 years later, inflamed kidneys led to an infection and 85% of her kidney function was lost.
This is way too much information in one sitting, so I actually asked her to stop, because at that point, she made me, I don't think it was her intention, but I felt like she was giving me a death sentence. I was ashamed because, 1, I thought maybe I didn't do something right when I had my lupus. Did I do something wrong? Did I not take my medication on time? Should I have taken it exactly at 8 o'clock? I felt for a long time that I did something wrong for me to lose my kidneys. And from there I felt that I wasn't going to be a whole person.
Jane decided to switch her treatment option to home nocturnal dialysis, which allowed her more freedom and control over her life. After much convincing, Jane decided to accept her mother's kidney, and the transplant surgery was a success. But Jane still felt something was missing. She and Mark wanted to start a family. Over the course of several years, Jane repeatedly asked her doctors if it was the right time to start a family. However, several medical conditions created setbacks, but every year, Jane would ask if the time was right.
He still felt that I should have a year of clean health, no problem, and I was fine. And he still felt that we should wait another year. And after that, he said, I don't think it's a good idea. We don't know how your kidney will function, your transplant kidney will function, and he basically said that in his professional opinion, it wouldn't be the best decision. However, he did refer me to Dr. Michelle.
My clinical passion and research interests evolve around pregnant women with kidney disease as well as glomerular-based disease. Like more intensive dialysis, kidney transplantation restores female fertility and the potential to have a family. However, pregnancy in a woman with any form of kidney disease is not without risk, requiring careful pre-pregnancy assessment by a team of nephrologists and obstetricians prior to pregnancy. Jane was no exception. We met once, we met twice, we talked on the phone, and then even emailed back and forth for months, weighing these risks and benefits over and over before she finally made her decision to proceed.
I always say that, Bronson is the angel who turned our love into a family. But really, there were a lot of angels that helped make this miracle happen. All the things I ever wanted was happening. I felt ashamed if I couldn't have a child. I didn't think that I was a complete person. and now I have a family. So I feel like I have nothing to be ashamed of anymore.
Will finished his last years of high school in Europe, returned to Canada to complete an economics degree at Queen's University, then traveled to Australia to play rugby for a year. He returned home for the Christmas holidays to spend time with his family. Within months, Will settled into a new place of his own and started his career. An avid rugby player, Will joined 3 competitive teams playing at the local, provincial, and national levels.
I was playing in a game and I took a pretty big hit in my kidney from behind, and I didn't think much of it at the time. You don't really feel those kind of things during the game. There's too much adrenaline going, and I wasn't really in a lot of pain, but there was blood in my urine, and that went on for about 2 months, and I made the mistake of not telling anyone. I thought it would go away. I thought it was just from a rugby hit, and I didn't want to not get to play the rest of the season, so I didn't tell anyone, but it started to get worse and worse. So I quickly ran up to St. Mike's because I could feel something was wrong. I went and had a biopsy done. And the biopsy, they just put a needle through your back to take out a little section of your kidney. And it's supposed to be just a simple procedure, in and out during just a one-day thing. But they had some issues with mine because it was a very small space they had to work with to get the needle in.
The surgeon that had done the exploratory surgery says, "This is something we better have a look at." At that time, we were introduced to new words in our vocabulary, like nephrons and nephrologists and things like these are not things you normally think about.
I was told the next day that from the preliminary reports that I had a very severe and rare kidney disease called IgA nephropathy.
Glomerular-based kidney disease accounts for approximately 25% of new cases of end-stage renal disease in Canada each year. Although rare relative to other causes of end-stage renal disease, this group of diseases generates enormous individual and societal burden, as it often strikes younger patients in the prime of their lives when they are busy completing their education and establishing their careers. The most common form of primary glomerular-based disease is IgA nephropathy. Up to 40% of patients with IgA nephropathy progress to renal failure within 10 years. In the most severe forms of IgA nephropathy, like Will's disease, we might have to use the same drugs that might be needed to treat cancer.
They were just saying, you know, you're going to start chemo, and I remember hearing about chemo. I remember hearing, you know, I might be infertile, I might not be able to have kids, I might lose my hair, just all the things that are going to happen, that are going to change, and it's just kind of, you know, it's very overwhelming.
I tend to be a pretty focused individual, so I just say, all right, we've got an issue here. Let's get the best possible guidance we can, and we will just outpower this problem and find out who knows the most about it and get that person's opinion and drive on from there. But it feels horrible. I mean, the first thoughts as a parent is, this, you know, let me have this. You don't need to have this. I'm 60. I don't have to, you know, let me be sick. Don't let my kids be sick.
I couldn't have gotten through without my family. It takes a lot of the pressure off. Like I said, my dad comes to all my medical appointments with me. He's always on top of all the doctors, asking questions and making sure we have all the information and tracking all of you know, the process, how it's going through, so I don't have to think about it too much.
Dr. Michelle is part of a group here in Toronto that have, you know, resident experts here in Toronto about IgA nephropathy is unbelievable. I mean, it's the best in the country or the continent or maybe anywhere. And being part of a study with this depth of knowledge was very comforting.
The biggest challenge for me was always with dealing with this. I just didn't want it to slow me down. I've got a lot that I want to do with my life, and at this, I'm 24 years old, so there's a lot that's happening right now. Everyone has their ups and downs, and everyone has their struggles, and everyone has their you know, hurdles in life that they have to get through. And you know, and on one hand, I could say that this has been one of the most challenging years of my life, and it's been horrible. But you know, on the other hand, it's been a great year, and lots of good things have happened. And you know, it's just everyone has their ups and downs. It's just something we have to deal with, and you know, you keep on pushing through.
This is a group of professionals in our backyard that can take care of us, and the reason they can is because there's research helping them develop their skills and knowledge over a period of time. I don't know if we ever understand you know, how important this research is until you need it. So if somebody said to me a year ago, you know, we've got world-leading nephrologist research right in Toronto, I think my reaction would be probably typical to anybody else you saw on the street and says, oh, that's nice. But when you need it, boy, oh boy, aren't we lucky that it's right here.